This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
You, as well as letting the baby be wrapped up in a knit that maybe your grandma made for him or her. But you've been doing this because this is what you were brought up around, and this is maybe a family tradition. But we have to pay attention to what the research shows to be safe and put this child to sleep. And you may be surprised on how many family traditions can put your baby in danger. Today you will be hearing from several partners in our community about this important topic and some exciting new resources to educate new parents and families about how to prevent accidental deaths of infants. But before we go any further, I'd like to introduce my colleague, Clark County Commissioner Tig Sagerbloom, who also serves as the co-chair of UMC's Board of Trustees with me. Commissioner Sagerbloom.
Thank you, Chair McCurdy. Unfortunately, there are an average of 3,500 infant sleep deaths per year in the United States. The key message we want to get across today is infant sleep deaths are largely preventable. The goal of the effort you are going to hear about today is for us to come together as a community to educate new parents, caregivers, grandparents, I'm a new grandparent, and others about how to keep babies safe. There are many resources available in our community for families and new parents, including right here at UMC's Healthy Living Institute and through Baby's Bounty, a partner in this effort, and the Clark County Parenting Project. You'll hear more about these soon, but now I'll introduce Commissioner Gibson, who does this in high heels backwards, speaking Spanish.
No, I don't. We're committed to raising awareness on this critical issue, the dangers of co-sleeping and providing alternative safe sleep practices. We know that all families have the tools that, we are prepared to ensure that all families have the tools that they need to stay safe and healthy and keep the little ones safe and healthy too. La campaña Sueño Seguro busca el bienestar de los bebés y sus padres. Educando a la comunidad sobre el sueño seguro, podemos garantizar que todas las familias tengan las herramientas necesarias para mantener a sus pequeños seguros y sanos. Como defensores compasivos de los niños vulnerables y sus cuidadores, es nuestro deber apoyar esta iniciativa de todas las formas posibles. Gracias a todos nuestros socios en esta importante labor. Now let me introduce English-speaking Commissioner Neff to say a few words.
Hello, good morning. So in a moment you'll hear from our partners with the Nevada chapter of the American Pediatrics Association, Las Vegas Metropolitan Police Department, and our dear friends at Baby's Bounty, who are doing critical work every single day for this community to help new parents and new parents in vulnerable positions meet the needs, get informed, and learn as much as they can about the new world they are entering. But for now, I can tell you about my experience as somebody who has a little boy at home who I checked the tag and can and will fit into this outfit tonight. I can tell you it can be exhausting. There are times when you are so tired that you think the easiest thing to do for your sanity and for your sake and for your family would be to let the baby fall asleep with you or to let them sleep on their tummy. But digging deep and knowing and having the resources from people like you all who have the expertise to tell and to educate and to work with the medical community, to work with our community at large, to tell people, to educate them and to teach them the right practices and the current practices, because as you heard Commissioner McCurdy and others say, a lot has changed from generation to generation. Best practices evolve and change, and we learn more. And it is so incumbent on us and our community and the county and each of you to really help spread the message of these best practices. So I applaud UMC and our partners here today for joining this cause. I look forward to putting Ari in this tonight and serving as a reminder to everybody that the more we know, the better we can keep people safe and protected, particularly our most vulnerable and the youngest among us. Thank you. Oh, yeah, well, most important, I think my real job here today was to introduce our colleague with the Metropolitan Police Department, Detective Jessica Rogers.
Good afternoon, everyone. I just want to say, first of all, thank you for having me. The first thing I want to go over is just some of LVMPD's stats. So in 2021, we responded to 24 co-sleep related deaths. In 2022, again, 24 co-sleep related deaths. The youngest child for that year was 6 days old. So just imagine being a brand new parent, probably just brought your newborn home, and then for the child to pass that way. And then so far in 2023, we've responded to 7 co-sleep related deaths. So the first thing that I want to go over is just to reiterate that these cases are 100% preventable. There's no safe way to co-sleep with your child. A lot of the things that we hear from a lot of the mothers are a mother knows best, or that it's the best way to bond with your baby. I've slept with all my other kids and nothing ever happened. Or also, I'm a light sleeper. I just think that this is such an important platform because it just allows us to educate our communities, and we just really need to caution them, any parents or potential parents, not to underestimate the power of exhaustion. Right? So you may, under normal circumstances, be a light sleeper, but then if you haven't slept for, 2 days, not straight sleep anyway, and, you finally get some rest and, like he was saying, you may think it's better to just kind of put the baby next to you. Not all the time is it the parents who roll over on their babies. There are times where, depending on the baby's age, if they're able to move, they might, move into the parent, or, the soft surfaces, the quilts and the blankets and the pillows and all those things that are creature comforts for us as adults, but they're death hazards to babies. So it's just best for parents not to do that. You can bond with your baby skin to skin and all those things that the hospitals talk about while you're awake, and if the baby's asleep. But you're the responsible one. They need to be alert, to try to ensure that, they are creating a safe environment for their children so that they don't have to then experience, the unfortunate death. We get asked a lot of questions sometimes. Is it a matter of people who don't have the necessary resources, right? They don't have a crib or a bassinet or something like that. I can honestly say in the majority of these types of cases, the calls that I've responded to, a lot of these people do have bassinets and cribs, and sometimes they have multiple ones, but they're not using them for their intended purpose. So we'll go to the home and we'll see that they have a crib over here and a bassinet over there, but they're full of like toys, miscellaneous junk, and sometimes literal garbage. So it's not that they don't have them, it's just that they're not using them. And I know for a fact that, like, if there's a new family or something and they don't have a bassinet or a crib, those resources are made available for free. I know there's multiple agencies that, will give cribs away and things like that because they're trying to prevent co-sleeping. Some examples of some cases that I've been on, and just to watch the devastation, that these families go through. We had a woman who, she had just had her 6th child. And she co-slept, her and the child's father, they co-slept with the baby, and she had her tubes tied after, she had this baby, because this was supposed to be like their last one. And unfortunately, the child passed. And we had to call her friend into the hospital room to basically talk her off the ledge, get her to put the baby down so that we could go and do our job. And she just, kept sobbing and repeating, this was supposed to be my last baby. This was supposed to be my last baby, because she's already gotten her tubes tied, so now she just is stuck with that weight, of thinking, maybe if I hadn't, but it's too late for her to go back. We've also had cases of people that co-sleep with twins, and then we go out and one twin doesn't survive and, the other one does. And again, like I said, people that, have cribs or bassinets and they're just not using them properly. They're not using them at all. We work these calls in conjunction with EMS staff, so like fire, AMR, Medic West community. And I also see that, the coroner's office, and then also LVMPD's crime scene analysts. So we all work in conjunction. We all respond to these calls together, and each agency does their specific part. And I see that the Clark County coroner, Melanie Roos, is here. Her investigators are a wealth of knowledge for us. We work hand in hand with them on every child death that we respond to. And they get to see firsthand, along with us, how these cases devastate families. Their lives will never be the same. This may be known as forever the worst day of their lives, right? And again, just to reiterate, it's something that could have been prevented. The safest way for an infant to sleep is alone, in a crib or a bassinet. No blankets, no pillows, no toys, so all that cute stuff that, you guys got from the baby shower, that you just can't wait for your kid to play with. It's not supposed to go in the crib with them. They're supposed to sleep on their backs, like they have here, on their back, with just a flat fitted sheet, and that's it, not even a blanket. I just want to say, everybody thinks that something like this won't happen to them, which is some of the reason why people continue to co-sleep, or even what we call an unsafe sleep, where they'll place the child in a crib but with a bunch of like the blankets and stuff. Everybody thinks it won't happen to them, and so they continue to do it, and they continue to think that it won't happen to them, until then we're meeting them at the hospital and asking them all kinds of imposing questions because their child is now deceased. And the reason why we respond is not because co-sleeping, is a crime. That should be the least of anybody's worry, that you're going to go to jail because I slept with my baby. The worst thing you have to worry about is that your baby is no longer here. We go to make sure that it is an actual case of co-sleeping or an unsafe sleep, and not something much worse, something that is criminal and trying to be passed off as a co-sleep or an unsafe sleep. So I just want to say I'm honored to be a detective in LBMPD's abuse neglect detail. They are some of the finest detectives and supervisors that I have had the pleasure to work for and work with. And I'm also honored and grateful to be included in this outreach effort. If even one life can be saved through this effort, I think it's worth it. But obviously, of course, we're hoping to save many more. So I just want to thank you guys for having me, and it's now my pleasure to introduce Jill Morano, the Director of the Clark County Department of Family Services. Thank you.
Thank you, Detective Rogers. Thank you for those sobering remarks for all of us. And just to piggyback on that, unfortunately, tragic cases of sleep-related deaths occur far too often. And as the detective mentioned, these are entirely preventable. There are many simple safety steps that, with adequate knowledge, can prevent these types of fatalities. The county has created a web page that includes resources in English and in Spanish. That website is clarkcountynv.gov/safe-sleep, all one word, for families and community members to log on to get more information. The theme of this Safe Sleep campaign is bedtime, nap time. Babies should always sleep on their backs. And to help carry this message into the community, our This Side Up onesies that Commissioner Naft has graciously modeled, and that his young baby will be sleeping in tonight, will be gifted to new parents through a coalition of many supportive community providers. That list includes the University Medical Center of Southern Nevada, the Healthy Living Institute at UMC, Baby's Bounty, Sunrise Children's Hospital, the Kirk Kerkorian School of Medicine at UNLV, the Nevada Department of Education, Office of Early Learning, and the Southern Nevada Health District. We have also developed Safe Sleep PSAs in English and in Spanish to share with local broadcasters and on our social media sites. And I believe now we have a premiere of those
Every
PSAs.
year, more than 3,000 babies in the U.S. die suddenly and unexpectedly while they're sleeping. Suffocation and strangulation in an unsafe sleep environment is the leading cause of death for infants under 1. My name is Sachi Kembak, and I'm a nurse at UNC. These tragedies are completely preventable. Babies should always sleep alone in their crib, face up and lying on their back. Infants should sleep on a firm sleep surface covered by a fitted sheet only. Do not add soft toys, blankets, pillows, soft bedding, or crib bumpers. Objects like these pose a suffocation danger for infants. To keep your baby warm while they sleep, you can use a wearable blanket, also known as a sleep sack. These offer a safer sleeping environment for your baby. Learn more at clarkcountynv.gov/safesleep.
Okay, thank you. We're just very grateful for the support that we've received from all of these community partners to help us develop this campaign, including the Nevada chapter of the American Academy of Pediatrics. And here to share some of our safe sleep tips, we also have Leanne McAllister from the American Academy of Pediatrics in the Nevada chapter.
Thank you so much, Jill, and thank you everyone for being here today. The pediatricians of the Nevada chapter of the American Academy of Pediatrics wants parents to know a safe sleep environment lowers the risk of all sleep-related infant deaths. The American Academy of Pediatrics has studied the data and knows how to prevent unintentional suffocation and strangulation in bed. Our guidance on self-sleep helped protect babies from these deaths. In the 1990s, a national educational campaign to put babies on their backs to sleep resulted in a substantial decline in the number of deaths, and it's remained about the same since the year 2000. Last year, the AAP released revised guidelines and added recommendations to reduce the risk of death while sleeping. The risk of sleep-related infant deaths are up to 67 times higher when sleeping with someone on a couch or soft armchair or cushion, and 10 times higher when sleeping with someone who is impaired or is a smoker. Risk of sleeping on the same surface with someone else also increases 5 to 10 times when an infant is under 4 months of age. If the baby is also preterm or low birth weight baby, regardless of other factors, that's also a higher risk. So, to reduce the risk of sleep-related infant deaths, the AAP recommends a number of simple precautions, and here are a few. The baby should sleep on a firm, flat, non-inclined surface. Sitting devices such as car seats, strollers, swings, infant carriers, infant slings, these are not recommended for sleep. They're not recommended in the hospital, they're not recommended in home, and particularly for infants younger than 4 months of age. We know that breastfeeding does reduce the risk of sleep-related infant deaths. And we also know that we want parents to sleep in the same room, but not the same bed as the baby, preferably for the first 6 months. Pediatricians advise that families avoid parent and infant exposure to nicotine, alcohol, marijuana, opioids, and illicit drugs. We do know that pacifier use is associated with reducing the risk, and it also helps if the child is receiving routine immunizations. So families can read all these recommendations and learn more on the AAP's parenting website, which is healthychildren.org. Our website is full of pediatrician-approved advice, and I encourage all of you to call your child's pediatrician with any questions or concerns. And now it's my pleasure to introduce one of the wonderful members of the Nevada AAP, Dr. Jessica Tay.
Hello, and thank you for joining us. I'm Dr. Tay. I'm a pediatric resident at the UNLV Department of Pediatrics. As a pediatrician, I want parents to know that we are here to help you. Learning about the importance of safe sleep is the first step, and there's been some great information shared here today. So thank you everyone for being here and being eager to learn. But just because we know what to do doesn't always mean we know how to do it. I want to encourage each and every one of you to talk through your thoughts, your concerns, and your fears with your child's pediatrician. Every child and situation is unique, so our best advice is based on what you tell us. There is no question that is too silly or too small when it comes to the safety of our kids. I had a great family in my clinic earlier this month, first-time mom to a beautiful baby girl. She was here for her 2-month checkup. She was doing great, growing well, smiling, doing all the baby things you expect them to do. Mom was clearly very knowledgeable and did her best to keep baby happy and healthy. When I asked her about sleep, I could tell she was hesitant. And then she finally said, "I know babies are supposed to sleep on their back, but my baby spits up a lot, and I'm afraid she will choke." So sometimes she put the baby on her stomach to sleep. This is a perfect example of where a pediatrician can help. I know this mom wants to do the right thing. So together, we were able to figure out a plan that we could address this spitting up concern while still maintaining safe sleep. Because yes, even in this situation, a baby is still safest sleeping flat on their back in a crib alone. And once you start this conversation with your pediatricians, I encourage you to have it at every visit. Because as you know, babies grow and change so quickly. As they advance in their development, a safe sleeping situation can look a little different. For example, an infant can be fully swaddled, but once a baby is capable of rolling over, they should no longer sleep with their arms restrained. If their arms are restrained in a swaddle, this could cause them to roll over to their stomach, get stuck, and increase the risk of suffocation. Now, these are details I would love every one of my parents to remember, but it's also our job as pediatricians to help remind you. I want everyone to know that we have the same goal in mind, which is growing this healthy child. And I hope that you're able to develop a relationship with your child's doctor where you're able to have these open conversations and come up with practical and, most importantly, safe solutions. When I became a pediatrician, it wasn't just because of the opportunity to work with the cutest patients. It was because we, as pediatricians, always have an extra teammate, the parents. And parents are someone we can always rely on. So by showing up today, you're telling us that you're ready to work with us and help keep our babies in Nevada safe. So thank you for that. It is now my pleasure to introduce Kelly Maxwell, who's the Executive Director at Baby's Bounty.
Thank you. Thank you for coming. So I think my colleagues here have spoken a lot about safe sleep. I want to talk a little bit about Baby's Bounty and what we do in the community to further this information, make sure our clients are all receiving it, and then the products that we provide to our clients so that they not only have the tools, but also the education to follow the guidelines that we're discussing today. So first I want to say that for 15 years now, Baby's Bounty has been committed to showing up for Nevada when the stakes are high. So we did that with the creation of our diaper banks in 2020. Now we've distributed almost 3 million diapers to 37,000 of Nevada's tiniest residents with locations in Henderson, North Las Vegas, and now Reno Sparks as well. We acted immediately in the face of the formula crisis, providing life-saving formula to over 1,000 needy families. And we continue to provide a good start for every baby with our Baby Bundle program. We're soon to celebrate the distribution of our 10,000th Baby Bundle. So that's all of the items that you see here. So clients who are referred to us will receive this complete Baby Bundle, which is a brand new portable crib, a brand new infant regulation car seat, 25 items of new clothing, bibs, rattles, baby books, a safe sleep kit, with some of the items discussed, with a pacifier and a sleep sack, toiletry kit, diapers, wipes, toiletry, all the items you need to care for a newborn for the first 6 months of life. But most importantly, the clients who receive this are required to take our Safe Sleep and Baby Basics course. This is a 30-minute interactive course offered on our website, babysbounty.org. It is free for anyone to take, but it is required of our clients. The class is written at a 6th grade level so that we're meeting our clients where they are. It's offered again in English and in Spanish, and it's interactive, so the client can't turn it on and go do some other things. They really need to interact with the lesson. For instance, they need to move all of the unsafe items out of the crib until they can move on to the next slide. So really driving home that, again, the safest place for an infant is alone on their back in a crib. So we're grateful to be a part of this program. We're grateful to continue to provide these baby bundles for our community members. When I arrived at Baby's Bounty 3 years ago, we were distributing 372 per year. We will exceed 1,200 of these bundles this year. So we're so grateful to further this message in our community and to participate with these individuals. And with that, Councilman McCurdy, you again.
Thank you so much. Thank you so much. As you can hear, there are a lot of resources that are geared towards making sure that we can prevent sleep-related deaths. And that wraps up this event today. But remember, education is the best way that we're going to be able to prevent sleep-related deaths. And in addition to Baby's Bounty, the Healthy Living Institute at UMC offers complimentary education and resources to the community for all stages of life, including several childbirth and parenting classes, as well as a free car seat safety check. These resources are not just for new and expecting parents, but for all caregivers. The Parenting Project of Clark County also offers free parent education classes, both virtually and in person, including a baby care class for teenagers. The number for this program is 702-455-5295. And again, we thank you all for joining us today. This concludes our kickoff, and we're going to take a few group photos, and then for members of the media, we can do some one-on-one pull-asides for interviews. Thank you so much for being here, and be safe. Thank you.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.